We usually do on Thursdays. We set aside a little bit of time to talk with members of our medical community. Today, joining us, Dr. Thomas Paulson with the New Hanover Regional Medical Center, the Betty H. camera facility there. And today we're going to talk about prescription drug abuse and the problems that come along with it. We were just talking a little bit off camera while Patrick was doing the weather. Patrick, no offense. I mean, these are things that are just laying around the home. I don't want to say laying, that people can find within the home and open the cap and have access to them.
That's true. These prescription drugs, which are powerful and dangerous, despite some of the misconceptions, particularly of the youth, that since they're legitimate, not off the street, how can they hurt them? They're ubiquitous. They have lots of true medical indications, and many families have them in their household, and it provides easy access to the kids who might get the idea that they want to experiment.
I don't want to, date myself, yourself. When I was growing up, though, maybe I was just naive, but I never heard of prescription drugs. It was marijuana, it was alcohol, it was things like that. When did we see kind of the transfer to these drugs where it became a prescription drug problem?
Well, I think in the 90s into the early 2000s, we had done a pretty good job about raising awareness to the illegal drugs. And at the same time, the myriad of prescription drugs for true medical-related problems blossomed. And so the ubiquitous nature of these things, like you say, being in the household, being available for impulsive, silly decision on the part of our youth, just made this problem sort of come out of nowhere.
If you're a parent, maybe a grandparent, and you are on a medication, what are some of the safety measures that we might take to make sure our young children, our teenage children, don't get involved in something like this?
Well, I think something just like what y'all are doing here, allowing me to help generate some more awareness that this has become it. They are the second most abused category of drugs after marijuana. That kids do this, and they aren't safe. They can overdose. Many people don't know how many of their Ambien are left in their bottle, or whatever other medicine we might be talking about.
Very good point, yeah.
You can count your pills. You can know where they're at. You can educate your children. Include these as also very potent and dangerous medications that they need to be aware of, just like the street drugs that we've been talking about for decades.
And I would think it goes along with everything else as your kids grow. It's just something you have to add into the conversation to talk to them about, to let them know, about the dangers of things out there. And that again, is why we do segments like this. Doctor, I appreciate the time for coming in today.
Well, thank you so much. I appreciate y'all letting this get out there.
And again, I always say, if you have any questions about a topic like this, you don't want to call me, you don't want to email me. He wears this for a reason. He's gone to school. He's done the work. I just answer phones. Doctor, thanks.
We're all in it together.
There you go. We're back with more after this.